Today I speak with Dr. Amar Agarwal, internationally renowned ophthalmic surgeon, pioneer of pinhole, pupilloplasty and glued IOL, and chairman and managing director of Dr. Agarwal's group of eye hospitals. Dr. Agarwal, welcome. It's an honor to have you with us. You have pioneered the techniques like phaconic, microphaconic, the glued IOL and PDEK, and you lead a global network of more than 250 eye hospitals. You run over 5,500 eye camps, treated over 750,000 patients, operated around 360,000 patients, free components included, and authored over 300 papers, over 60 books, performed over 150 live conferences. So what first inspired you to specialize in cataract and anterior segment surgery?
Basically, my parents, Dr. J. Agarwal and Dr. Mrs. T. Agarwal, both were eye doctors. And from childhood, somehow I was fascinated by eye surgery. And they started with one hospital in Chennai, India. Subsequently, we started expanding in 2006, and now with more than 270 plus hospitals, we have reached this stage. At present, we are opening one hospital every week. So approximately in a year, we are doing about 60 hospitals. And in Africa, we started our first hospital in Mauritius in the year 2010. Now we have got 3 centers in Mauritius and more than 20 hospitals across Africa in various countries. We are in Zambia, we are in Madagascar, we are in Ghana, we are in Kenya, Zambia, etc. Tanzania also. That is the path of my life, to be honest with you, which we love, because the amount of blindness in the world, if you see globally, is huge. And if we can reduce that by some method, by some treatment, it is a big, big thing. Our idea is to be at the doorstep of people so that everyone can access this high-tech eye care. That is why in Mauritius, we have 3 centers. And our main purpose now is to open a specialized eye transplant center and a pinhole pupilloplasty center in Mauritius, where we'll be able to do eye transplantation or corneal transplantation and this latest technique called pinhole pupilloplasty in Mauritius. And this is going to be inaugurated on the 10th of December by His Excellency, the President of Mauritius.
So we are talking about the new transplant center. How is it going to bring benefits to Mauritians here?
The way we are seeing is this. Let us say some person is blind because the front window of the eye, which we call as the cornea. Imagine if you have a camera in your hand, the rays of light have to move from the camera into the film of the eye, camera, which is the studio where you'll develop it in. Similarly, our eye works. The ray of light goes in through the front window, the cornea, passes through the lens, like the camera has a lens, reaches the film in the eye, it is called the retina, and goes to the best studio in the brain. That's here. The best studio in the world is the brain. Automatically we are developing. That's how you see me, that's how I am seeing you, and that's how all those who are watching this telecast right now are seeing. Now imagine if somewhere in this path the rays of light are blocked, the person can't see. So the front window, let's say it has got an injury, a scar, a disease where the front window has become conical, which is called a keratoconus. Or there are many cases which require eye transplantation or corneal transplantation. What we do is we take a donor cornea, that means someone who's passed away, he has 2 eyes. So we can transplant it in 2 patients. That's the best donation any human being can do after death. Donate his eyes. Because either they're going to get buried or burnt. Here you're donating the eyes and we transplant that to a normal living person and the person starts seeing. And that is what is happening in Mauritius with this new corneal transplantation center.
And normally, after what you just said, I get the impression that this is the next major shift in ophthalmic surgery. So why, according to you, is corneal transplantation an urgent need right now?
You see, corneal transplants, if we see in the world globally, about 20 million to 60 million are there blind globally in the world, waiting for donor corneas. Imagine that means we need to get 60 million or 20 million donor corneas, which is really impossible to get. The second problem in eye transplantation or corneal transplantation is, one, I need a donor cornea. Two, I need a surgeon who's mastered this technique. I need equipment. Also, please remember, after all this, after all, I'm taking a dead person's cornea and transplanting it to another person. There can be a rejection. This is a reality. Also, the person is put on medication for some years. So now this latest technique, and this is the same center which we are opening also with the Honorable President of Mauritius is going to inaugurate on the 10th of December 2025 is Pinhole Pupilloplasty Center. So the idea here is very simple. What we are doing here is we are going to make the eye like a pinhole. If you make your hand like this in a circle like a pinhole and see the monitor in front of you, you will actually see better. Whatever your power. Now when these people have scars in the cornea or keratoconus or some cases where they need transplant, the rays of light are getting diffracted away. So like you have myopia, that is minus number, hyperopia plus number, another refractive entity is called aberropia. That means aberrations are there in the eye. Now imagine if I can make the pupil, the diaphragm of a camera, small like this into a 1 to 1.5 millimeter pupil, all these aberrations are cut off and the rays of light go straight to the retina area where we want it to hit, and it goes to the best studio in the world, the brain, and the patient does not need an eye transplant. Please understand, I am not saying that all the transplants can be treated without transplant and done pinhole, but a huge bunch of patients who need transplant avoid a transplant and have instead a pinhole pupilloplasty. So what is the difference? And in our hospital, we are going to give both the facilities available. That's why it's called the corneal transplant and pinhole pupilloplasty center. So depending on the patient's indication, we'll either go for a transplant or we'll go for a pinhole pupilloplasty. But the advantage of the pinhole pupilloplasty, let me explain. The whole surgery takes about 15 to 20 minutes. Now, the patient is on medication just for 4 weeks. Just few drops are put 3 times a day. The bigger story is in the morning when I do the surgery, and by the evening or the next day morning, the person is able to see differently huge. Another big thing is he can see distance and near without glasses. Because when I make it like a pinhole, I get a depth of focus. That means I can see distance and near without glasses, which is a huge difference. There's no chance of rejection because there's no transplant. So rejection is out of the question. There are no sutures put outside the eye. So reaction or infection of the sutures which can happen with a transplant again get avoided. Let us say theoretically, I have seen patients with post-transplants where the grafts are clear, the aberrations are so much, still they don't see. Those patients who've had transplant and are not seeing, my message is, they also can have a pinhole pupilloplasty. And it's vice versa. After pinhole pupilloplasty, if you want to do a transplant, also you can do. Because it will anyway benefit the patient after the transplant, because as I said, all the aberropia which he has will get nullified. So all in all, to take a long story short, our idea in this Mauritius center is to make it like the mecca of healthcare or eye care here, so that we can advise the patient both the corneal transplant and a pinhole pupilloplasty at the same time. So depending upon the indication of the patient, the surgeon will decide which one is required, but both are available under the same roof.
And maybe some people will say, if they are eligible for that, how do they know if they qualify for the pinhole or the transplant?
So very simple process is, first is they have to see the doctor. Once the doctor sees, he will decide. What we have designed is a small device which has got different pinholes like 0.5, 1, 1.5, 2. Now what we do is we put it in front of the patient and we ask the patient, you're not seeing anything now. Now look in front of this. Suddenly, let's give a theoretical example. Through 1.5 millimeter pupil, he sees the last line on the board. Then we know, the patient also knows, this is the way I'll see. So before the surgery, I've already assessed how the patient's pupil should be, what size it should be, what location it should be. So the surgeon will make the pupil exactly the same size. Let's say if he wants a 1.5 millimeter pupil, we'll make the size 1.5. The location, again, if the scar is here, I'll make it exactly avoiding the scar so that the rays of light can pass through. It's basic physics. Actually, if you see pinhole, if you see the Olympic shooters, they also have a pinhole in front of their eyes. You know, it is legally allowed by the Olympics where they have a pinhole so that they can see better, because in Olympics, you need to have extremely clear vision. And that is why if you see a top shooter will have a pinhole here, he'll adjust it so that when he's shooting, one eye is obviously closed. He's seeing through the eye where the pinhole is, he can see better, he can adjust the pinhole, and when he sees best, he keeps the pinhole at that size and he shoots. So this is pinhole eye surgery or pinhole pupilloplasty. Today, this surgery is happening in the United States, is happening in Russia, it's happening in Vietnam, and in many other countries. Our idea is to have this happening in Africa, in Mauritius, and obviously around the world globally.
And maybe something regarding the training. So are Mauritian surgeons trained to do that, or only your teams that will conduct the specialized training locally?
No, we always believe technology like this should be taught to everyone. For example, in Africa, we have doctors who are African who are training. So many of them are trained with me, taught by us. They see videos which we have on the YouTube videos, on Instagram. All you have to do is type pinhole pupilloplasty and you will see a lot of videos. Even for the layman who's not a doctor, he will immediately understand what it means. Because there are patients, let's say a cracker injury. A child comes to me with a knife injury. See, a small child, let's say I have done a 14-year-old child. If I do a transplant, he has to live, let's say, for the next 60, 70 years. The chance of rejections are there more. Whereas when I do a pinhole, next day or within a week, he's seeing beautifully without glasses. And the best part is, as I said, he sees distance and near without glasses.
So in the future, do you foresee collaborations with public hospitals?
100%. We do see a lot of collaboration with the government hospitals, with the private sector, because the idea of both the hospitals, whether it is in Mauritius, whether it is in Africa, India or globally, all of us have only one vision, and the aim is very clear: to eradicate blindness so the human beings can see better. Imagine for 5 seconds, if we close our eyes, believe me, a fear will come. That is how a blind man is seeing. It is a scary phenomenon. And our idea, our endeavor of the Agarwal group of hospitals is this: to try to eliminate this blindness as much as possible. One more thing I'd like to mention at this time is cataract, because that is one of the biggest problems in Africa, in India and globally. Now when you have cataract, let's understand it is a very simple phenomenon. Imagine you have a camera, and if I put sand on the lens, can you take a photograph? You cannot take a photograph. You have to throw the lens, but obviously you have to fix back a new lens. So obviously when the cataract is removed, we have to remove the cataract and fix another lens inside, which is an artificial lens called an IOL or intraocular lens. The problem here is, suppose somebody has a punch in the eye, or a bomb blast, or some complication has occurred, or he has left his cataract so late it has burst. In these cases, where do I fix the lens? I have no space to put the lens. So we brought out this technology called the glued IOL. It's called GLUED, glued IOL. And those who are watching this telecast can just type on this glued IOL and you'll get it on the Wikipedia and explain to you what it is. But in a simple nutshell, I'm going to fix the lens with glue. Now remember, if I use a synthetic glue like Fevicol or something like that, I will stick 2 pieces of paper. But in a human eye, I cannot use it because it is dangerous. It is reactive. It is not safe. So the glue which we use is natural glue made from blood. So you can imagine a glue made from the human blood is absolutely safe. And this is called fibrin glue or natural glue. We use this and the whole intraocular lens is stuck in place and does not move. In other words, with all these complications, like let's say an injury, a bomb blast, a punch in the eye, or a complication in surgery, all can be solved by the glued IOL. So this innovation of the glued IOL also came out from the Agarwal group of eye hospitals, where we can solve all these patients.
So normally, after how long normally the patients can see improvement?
In the glued IOL, yes, they can see it immediately. So let's say the patient is not seeing with glasses. He doesn't have a lens. So when I do the glued IOL, by next day, immediately he starts seeing. So as I said, this combination of conditions are there, where I can do a glued IOL if needed, we can do a transplant if needed, we can do a pinhole pupilloplasty if needed. So depending on the case or the condition, we do it. Even patients who have got, let's say, transplants, this new technique we started called PDEK. It's called pre-desmase endothelial keratoplasty. Again, you can just Google it on the net. Very simple is, when you do a transplant, I'm taking a whole cornea and transplanting it. In PDEK, we are not doing that. We are taking only 25 micron, that is like a thin hair. So when a person is blind, I take from the donor a thin hair of tissue, 25 micron, inject it inside this living human being, and the cornea, which is absolutely bad, clears. So you can see this is called PDEK. Our idea and endeavor in this story is very simple. What is needed for the particular patient at that thing, we will perform. And all this will be available under one roof.
And maybe for all the patients, are there any issues after that?
We have done these cases in young people. I've done it in elderly patients, 80 years, 90 years, I've done it. The biggest example of a glued IOL was my own mother-in-law, who was operated some 40 years back and left without glasses. And we fixed her with glued IOL. So that's one big example of glued IOL. And coming to pinhole pupilloplasty, I've done it again in small children who have had injuries. I've done it in young people with keratoconus, things like that. I've done it in older age group also, who have come to me with injuries. I remember one patient came to me with a badminton injury, because badminton is great sport, but sometimes when it injures, it cuts the whole eye. And luckily, straight away came to our hospital, was referred to our hospital, operated him in India, and he started seeing very clearly.
And maybe are there any changes in the lifestyle of the patients after that?
Actually, they are fantastic, because see, these people, whether it's a child or an adult, he sees distant and near without glasses for life. So what happens is, the advantage which he gets is, he doesn't need glasses now. So suppose you do a child surgery, transplant, give an example. You have to give him glasses for distance and give him glasses for reading. And then when he goes to school, it's sometimes awkward for the small child. Here, with the advantage of the pinhole surgery is, or the pinhole pupilloplasty is, he can see nicely the blackboard on the top, and he can read and write very clearly without glasses. That makes a huge difference.
Maybe we would like to know the success rates of these.
The success rate is extremely good, but let's theoretically give an example. Let's say the scar is so bad, the patient not seeing so clearly. All you do is then you can add a transplant to it. So the beauty of this surgery is I can always do a transplant, and the pinhole pupilloplasty will always anyway help him. Because once I've done the transplant, he might need a pinhole pupilloplasty anyway, because he might still have abrobia with the pinhole, with the transplant there. So that's the best part of this whole thing. So the success rate when we do, we have published our results, which are extremely good. And today, as I said, this is why it's happening in the United States. Other countries like Russia, Vietnam, and other countries are now doing the pinhole pupilloplasty.
And all these are conducted in Mauritius. No need to travel abroad to do that.
We are having this center opened in Mauritius on 10th of December by the Honorable President. Endeavor is this, that we want the patients in Mauritius to benefit in Mauritius itself. They should not travel.
And maybe something else regarding the cost, the affordability, because some people may say that this is costly. So how do we...
You see, the cost of this surgery is nothing compared to a transplant, obviously, because there is a technical skill in this pinhole pupilloplasty. But to be honest to you, it's not so complicated, somebody cannot learn it. And that is why many people have moved on to pinhole pupilloplasty slowly. If I don't have to get a donor cornea and make my life easier by doing a surgery which is easier, safer, with less complications and better results, obviously it is a game changer. And that's what pinhole pupilloplasty is.
Is there any financial support that's been provided, like insurance and so on?
There should be, depends on each country. They have, it's well and good. And if they have, I think it's the best thing which we can do it. But the main thing is so many people can benefit from this. And that's what we would like to look at.
And any final message for the patients or policymakers or even our viewers who are looking at you right now?
The most important thing what I tell people is this. If we just close our eyes for 5 seconds, we'll realize blindness. All of us should understand prevention is better than cure. So when someone is diabetic, I advise them to control that sugar. Go to an eye doctor, get examined, because the eye is the window to the brain. That will tell you exactly if you have a problem. If you have a small cut, small injury, don't try to treat it yourself. Go to an eye doctor, whichever country you are living in. They've got everywhere. Go to some good doctor or any doctor you want, but do not treat yourself. So remember, the moral of this whole story is prevention is always better than cure.
Thank you so much for sharing your insights, Dr. Agarwal. So that was Dr.